Hi everyone, this is Denora Millhouse. Which of our mothers, wives, daughters, sisters, and friends would it be okay to lose? If you have not been personally diagnosed with breast cancer, it is likely that you know someone who has. I know several breast cancer survivors, and their testimony is that early detection can save your life. Now, unfortunately, I lost a cousin to breast cancer about 15 years ago, but she never lost hope. Based on research, the Centers for Disease Control reports that in the United States, about 237 women are diagnosed with breast cancer each year. And about 41,000 of those cases, they die from breast cancer. So today, I would like to talk to you about the importance of early detection through monthly self breast exams, clinical breast exams, and mammograms. I also want to share some cancer signs and symptoms to make you aware that early detection can increase your chance of survival. So, first, we will discuss mammography and how effective this early detection process can help to save your life. A mammography is a specialized medical imaging x ray that is able to see inside of the breast. Mammogram screening should begin in women at the age of 40. But if you're at a higher risk, those screenings should begin as early as age 25. It is unfortunate that about 67% of women only report having a mammogram in the last 2 years, and 50% is reported to have a mammogram in the last year. But women need to know that mammograms or mammography correctly identifies about 87% of breast cancer, making it an essential process in the early detecting of breast cancer. So please schedule a yearly mammogram. Call a family member or call a friend and ask them when was the last time you had your mammogram. Second, we will look at the clinical exams and how effective this early detection process can help in saving a life. A clinical breast exam is a physical exam done by a healthcare provider and is often during your regular medical checkup. So it's nothing that you have to go and schedule a separate appointment from. You can have it done during your regular medical checkup. And it is performed by a trained healthcare provider or professional, and they're checking for lumps, any physical changes in appearance, size, and shape of your breast. They also check the skin covering of the breast for rash and dimpling, and they check the nipple to see if there's any scaling and fluids when likely squeezed. The clinical breast exam identifies about 12% of breast cancer, and it should begin in women and teens at the age of 25. So again, ask your family members, ask your sister, ask your friends, did you have your scheduled clinical breast exam? Because it's important in the early detection of saving lives. So third, we're going to discuss the monthly self-breast exam and how effective this early detection process can be in helping to save your life. Now, unfortunately, the monthly breast self-exam, they're now considered optional by some by they're now considered optional, but doctors are still urging patients to perform these exams monthly to become familiar with how their breasts feel and to detect any changes. I mean, think about it. Who knows your body better than you? And research has shown that 40% of women discover their own tumors during that monthly breast self exam. And those tumors, once discovered by you, are normally half the size of those discovered when you have a mammogram or the clinical breast exam. So that also signifies that you know your body better than anyone. And a monthly breast self exam only takes about 10 to 15 minutes each month. It costs nothing and it can be done in private. So pick a date to schedule your monthly breast self exam and call your family members, call your friends, and ask them to do the same. So lastly, we will discuss some signs and symptoms of breast cancer and the early detection of saving your life. The common sign and symptoms are skin changes, swelling, redness, or a visible difference, like if one breast is larger than the other. You have changes in one or both nipples and pain in your breast. Now, surprisingly, there's two uncommon signs and symptoms to be aware of, and that is back pain and neck pain and unexplained weight loss. So today we have discussed the mammograms, clinical breast exams, and monthly breast self-exams, which are three vital steps in early detection of breast cancer and helping to save a life. We've also shared information regarding common and unusual signs and symptoms to be aware of. Efforts to promote early detection continue to be a major focus in fighting breast cancer. Today, if all women would do breast self-exams, see their doctors for a clinical exam, and have mammograms regularly and yearly, 95% of all breast cancers could be halted before they become fatal. So I ask you again, which of your mothers, your wives, your daughters, your sisters, and your friends would it be okay to lose? And the answer is none. So starting today, make it a priority to begin your early detection process and join the effort in promoting early detection by asking your mothers, your wives, your friends, and your family members, when was their last breast exam? You could also set up a group. I think we all in South Carolina are familiar with the Buddy Call 19, and that's the 19th of each month. You perform your monthly breast exam, and you call a friend or a family member and remind them to perform theirs. That's just one example of the way that we can help in the fight of early detection to prevent breast cancer's death in the United States and around the world. Early detection saves lives. Join the fight. Thank you.